Now comes the highlight of our meeting, where John, Rich, and I recognize the first Georgetown Distinguished Achievement Award in diabetic limb salvage. We chose the person who we feel is a foremost national and international ambassador for limb salvage in diabetes today. To present that award, we're delighted to have the Vice President for Medical Affairs at Georgetown University Hospital, Dr. Richard Goldberg.
Thank you, Chris. It's a pleasure to be here, and it's a pleasure to see such a successful conference. My congratulations to you and the co-chairs for putting the conference together. It's indeed an honor to help present the first Georgetown Distinguished Achievement Award in diabetic limb salvage to Dr. David G. Armstrong. I'm going to draw on some thinking from Helen Hayes, the great Broadway film actress. Achievement, she said, is the knowledge that you have studied and worked hard and done the best that is in you. Success is being praised by others. Success is nice, Ms. Hayes said, but it is not as important or as satisfying as achievement. Today we are celebrating the achievements of Dr. David Armstrong, but we also want to praise him a little as well, and I'm sure David will forgive us if we point out a few of his successes, especially in the important area of diabetic limb salvage. Dr. Armstrong, as most of you know, is one of America's leading lights in the research on diabetic foot disease and diabetic limb salvage. As director of the Center for Lower Extremity Ambulatory Research, or CLEAR, in Chicago, Dr. Armstrong and his group at CLEAR have produced more than 200 peer-reviewed research papers in 24 scholarly medical journals, as well as over 24 book chapters, an amazing, prodigious production there. David is also a dedicated clinician and respected educator. He is professor of surgery and associate dean of the Dr. William M. Scholl College of Podiatric Medicine at the Rosalind Franklin University of Medicine and Science in Chicago. And he has previously held faculty positions at the University of Texas Health Sciences Center in San Antonio and the University of Arizona. In addition, he co-founded with Dr. Vicki Driver the renowned National Center for Limb Preservation, also located in Chicago, and is co-editor of the American Diabetes Association Clinical Care of the Diabetic Foot. Although he is based in Chicago, Dr. Armstrong travels almost constantly around the country and internationally. Indeed, one of his achievements is that he brings an international perspective to diabetic foot and diabetic limb salvage issues. After all, limb loss knows no national boundaries. Dr. Armstrong is international even in his medical education. He holds degrees from the universities in 3 different countries. He was graduated with honors from the California College of Podiatric Medicine, holds a Master's of Science in Tissue Repair and Wound Healing from the University of Wales College of Medicine, and a PhD from the University of Manchester College of Medicine in England, where he was appointed visiting professor of medicine. With Dr. George Andros, he co-founded the world's largest annual international symposium on the diabetic foot called DEFCON. Dr. Armstrong has been selected to serve in numerous international positions in wound healing and diabetic foot care. He was selected as one of the first 6 international wound care ambassadors, and he was the first American chosen to serve on the executive board of the European Association for the Study of Diabetes Diabetic Foot Study Group. Dr. Jonas Salk once noted that the greatest achievement and reward for achievement is the opportunity to do more. And those who know him believe that David, who is not yet even 40 years old, I don't know how he's gotten the time to do all those things, is going to continue to achieve, to make new breakthroughs in the science of diabetes care. He has worked tirelessly to save limbs and to improve the quality of life of diabetic victims around the world. It's been said that the greatest achievement builds a momentum that shall endure until the sun grows cold. But I believe that in David's case, he would hope that his achievement simply will contribute to saving of limbs of patients who, like those in the video we saw at the beginning of this conference, are struggling with diabetes. So it is my great pleasure, on behalf of Georgetown University Hospital and the MedStar Health Organization and the Georgetown Conference on a Team Approach to Diabetic Limb Salvage, that we now present Dr. David G. Armstrong with a Georgetown 2007 Distinguished Achievement Award in Diabetic Limb Salvage. David, congratulations.
Very good.